Hi, my name is Juby Bergano. So for today's video, I'll be doing the return demonstration for nasogastric tube insertion, feeding, and removal. But first, I'd like to discuss what a nasogastric tube is. So a nasogastric tube or an NGT is a flexible plastic tube inserted through the nostrils, down the nasopharynx, and into the stomach or the upper portion of the small intestine. These tubes feeds patients who may have swallowing difficulties or require additional nutritional supplements. And remember that the NG tube or the nasogastric tube placement is always confirmed with an X-ray before use. This tube is used to deliver nutrients to the patient via feeding, and this type of tube that uses for feeding should be labeled. Okay, so before starting the procedure, I must verify the doctor's order, and then next is to get all the equipment needed. In this case, we need a silicone nasogastric tube, and then take note that if the tube is rubber, we must place it in a basin with an ice for at least 5 to 10 minutes. And then we also need a septal syringe, micropore, clean gloves, water-soluble lubricant, stethoscope, a glass of water with a drinking straw, syringe with an adapter, basin, and a disposable pad. And then I will perform hand hygiene. So upon entering the patient's rooms, I will greet the patient, introduce myself, and verify the patient's two identifiers, which are the name and birthday. And then next, I will ensure the patient's privacy by closing the door and draping the curtains. And then I will explain and educate the client about the procedure and how he can cooperate. So before doing the NGT insertion, I will first assist the client in a high power position or an upright sitting position and ensure that he is comfortable, and I will cover his chest with a disposable pad. And then I will ask the patient to hyperextend his head to check the nostrils for patency. So now, I'm going to inspect the lining of the nose to see if there's any irritation or abrasion using my pen light. Also, inspecting the nostril is a great way to find which side of the nostrils has the greater airflow, so we can determine if where we can insert the tube. Then I will assess the patient's gag reflex and abdomen. So next is to determine the size of the tube. So I will use this tube to mark the distance from the tip of the nose to the tip of the eardrum up to the tip of the xiphoid process. Then I'm going to put on adhesive tape as a marker. So I'm going to put a adhesive tape here. So this will be my marker. And then next, I will wear a clean gloves. And then I will lubricate the tube tip, which is this one. So I will lubricate it using with a water-based lubricant. And then I will ask the client to lift his head and gently insert this tube into his nostrils. So let's assume that I already insert this into his nostrils. And then I'm going to insert it directing directing the line downward and backward. You will notice that once the NGT reaches the pharynx, the patient may gag. And then I will ask the client to sip water through a straw. So while the patient sipping the water, I'm gonna advance the tube each time the patient swallow. Then I will continue to advance the tube gently until I reach the desired length of the insertion. Then I'll inspect the patient mouth to ensure that that the tube is not coiling. Sir, can you open your mouth? And then I'll check the tube. I'll check the tube if it's in place, and I'll ask the client to talk. In this case, I will wait for an X-ray, which is the gold standard, to ensure that the tube is in the right place. And then after confirming that the tube is in the right place, I will clamp the tube. And then after I clamp the tube, I will secure the NG tube by taping it in the bridge of the nose. So I will tape it using my core. And then I will record the date and time of the tube that was inserted. And I will endorse it to the next ship. So now I will do the feeding, but first I need to assess the tube placement of the patient. So I will inject an air using the asepto syringe while assessing the stomach of the patient if there's any gurgling sound. So I will do it now. So I heard a gurgling sound, which is indicate that the tube is in the right place. And then the next thing I will do is to, of course, first check the hospital policy, check the expiration date of the feeding, and warm it in a room temperature. And then I will remove the cover of the asepto syringe and connect the syringe to the NGT. Then add the feeding to the syringe barrel and flow the feeding as per the prescribed rate. Next is to flush the time immediately before the formula has run through the tubing, and then attach the cover of the asepto syringe. And then I will advise the patient to remain sitting in an upright position for at least 30 minutes. And then I will close the tube ports, and document all the relevant information, including feeding, amount of solution taken, the duration, the volume of the feeding, and the water administered. So in this part, I will do the removal of nasogastric tube. So the first thing I need to do is to assist the patient in an upright sitting position. And then I'll make sure that the patient is comfortable before I start the removal of the tube. And then I will place a towel across the chest of the patient. And then I will give him a tissue. And then I will prompt the patient to take a deep breath and hold it while I smoothly pulling the tube. So sir, take a deep breath and hold it. Okay. So once I pull the whole tube, I will place the tube immediately in a disposable plastic bag. And then I will inspect the mouth and nose of the patient, and then I will ask the patient to blow each side of his nose. And then lastly, I will document all the relevant information, including the removal of the tube, the amount and the appearance of drainage, and I will ask him if there's any symptoms of nausea or vomiting, and then I will perform hand hygiene.